Hi, my name is Danya Sawan. I'm a registered massage therapist working out of Toronto, and this is Soft Tissue Support. So, first question, why should women weight lift? What if it makes me look masculine? Okay, so there are many reasons why women should weight lift. I don't know why it's controversial that women should weight lift. It's actually completely medically recommended, especially as you age. So it's actually more recommended for women to clinically weight lift than it is for males to clinically weight lift. Males, listen to me. It's for the same reason that men do really well with cold plunging, because their bodies are more prone to inflammation and cycles of high inflammation, hence maybe a more extreme reaction to getting a cold or being sick, as girls and women like to joke that they're having a man cold, but the fact of the matter is their body inflames very easily, and cold plunging then makes the male body used to calming down much faster and lessening that inflammation, which actually prolongs their life. They burn too hot, right? As opposed to women who actually suffer from a lot of autoimmune disease, suffer from more chronic disease as opposed to acute, and almost seem to not have inflammation at the right times or enough high inflammation to eliminate issues. We have like a low barrier of inflammation, which doesn't really resolve issues a lot of the time. So it takes our immune system longer. Cold plunging that or applying cold to that doesn't work for us like it works for men, because it hinders what we already have hindered, which is energy or heat or power, pushing our body forward. Weight lifting grows everything in a female body that necessitates an increase of iron production, muscular growth. Muscular growth makes it highly necessary for your body to then store calcium in the bones. So it directly battles osteoporosis, and bones that are the storage system of the body then make it way easier for your bone structure as you age to retain and signal to the thyroid and to your brain and to your ovaries, even as you age, go into perimenopause and menopause, that you still need to retain some of those hormones and still need to manufacture some of those hormones that your body thinks you don't need to anymore, because you're not producing eggs and you're not producing children, babies. Reproductively, you are done reproducing and now you are living for a different purpose, right? As a woman, we outlive our reproduction, unlike men, right? So that in a nutshell is why women should weight lift. Weightlifting pushes our system into a necessary growth, a necessary heat, a necessary consumption of food, bigger appetite. Women cannot function properly if they are below a certain weight, if they lose a certain amount of adipose tissue, if they lose a certain amount of bone structure. We're meant to outlive the years that we have that automatically being given to us by nature, but rarely do I see women age well. That's the shortest answer I can give to that question. Okay, next one. I lost a lot of weight and my joints feel better, but I have noticed that I look older. What is that about? What that is about is that there is a correlation between being overweight and an excess of estrogen sometimes, and sometimes it's not good at all. Sometimes having an excess of adipose tissue or adipose fat in your body can actually throw off your hormones, but also having a lack of it can throw off your hormones. So you can see this in athletes that are pushing themselves too hard or have dipped below a certain weight. You see this in people with eating disorders as well, is that they have lost too much adipose tissue to be able to maintain their hormones properly. And so sometimes a sudden weight loss can not only take away what was giving you baby cheeks or like a rounder face, so that your skin suddenly looks like it's deflated. But it can also cause a premature lessening of the hormones that give you the appearance of youthfulness and supple skin. So it causes you to look like you're aging, even if genetically you're blessed and you're not really showing your age. So if you're planning on losing weight severely, I would take all these things into account, because losing weight isn't always the ideal situation. We're fixated on it as a culture, and instead we should be fixated on health and strength, as opposed to being thin. Nature didn't design us to be thin, it designed us to be fit. And there's a huge difference between those two words, especially for each individual. That means different things for different body types. I would listen to a nutritionist, I would involve a doctor in what I'm doing, and I would get a personal trainer or get someone who understands about soft tissue and adipose tissue and about that sort of thing. Ding ding, you're a girl. Okay, next question. What is the difference between a masseuse and a massage therapist? That is a good question. Okay. So I will speak specifically for Toronto, Canada, where I am certified to work. And the difference is that word certified. I am a registered massage therapist, which means that I'm actually a low tier healthcare practitioner. Yes, I work in soft tissue rehab, but I have to buy malpractice insurance. I answer ultimately through the CMTO, which is my part of the College of Physicians. I answer to a part of the ministry that monitors what I do behaviorally and functionally. And I have to keep my education up. I have to really know what the peer review science is saying. My clinic has to pay insurance to be open and functional. I have to follow certain hygiene practices that by law I cannot choose to just forgo. I keep records that I send to doctors. I understand HIPAA, which is the confidentiality, by law, ministry-based, healthcare practitioner ministry-based, legal portfolio. Masseuse is someone who has not undergone the education, is not governed by the government, not monitored by the government, is under none of those obligations, and probably does not pay malpractice insurance. A masseuse can do a lot to make you feel really, really good, but they may not understand the medical basis for what they are doing and how they may harm you. In fact, a lot of people think that therapies, non-invasive therapies and holistic therapies are low impact anyway, and it's very hard to hurt someone through them, and that's actually really incorrect. It's the reason we have up to $5 million insurance for compensation if we really badly hurt you, and it is proven in a court of law. I hope that answers the question. Okay, last question. My dentist injected Botox into my jaw to help my TMJ. It still hurts, but something weird is happening to my face shape. Yes, okay, so there was no question there, but I will explain. Your dentist and doctors in general are highly specialized in what they do. So if you have TMJ, temporomandibular jaw disease issues or dysfunctions, the only way a dentist can relieve your pain is to weaken the musculature in your face, right? As a soft tissue person who also did extra schooling in TMJD and treats people for TMJ intraorally, if you put Botox in a muscle, you stop it working and you cause it to atrophy. Any muscle that isn't working, the body goes, hey, I don't need this thing to be this bulky or have this much strength and bulk. I don't need to feed it as much. There's other areas in the body that I need to allocate resources to, right? So that muscle undergoes muscle wasting. Now, TMJD is very complex. Usually it is a symptom and not a cause. So you can absolutely take the air out of the masseter muscle, which is the muscle that gives a lot of people their jaw shape right here, which of course will cause it over time to become smaller in size and to waste away, right? So that's why you're experiencing a face shape change, because you're getting Botox in a muscle that is now shrinking, that was probably really clenching really hard, really strong, and probably maybe giving you like a cut jaw. So you may want that if you are male, or you may not want that if you are female. I myself have TMJ, and one of the things I consider a blessing, all to Jesus, thank you, is my strong jaw, because I prefer a strong jaw, even as a woman. I think it makes me look less aged, and I'm no spring chicken. But, however, everybody's different, right? So, getting Botox to relieve TMJD can be a double-edged sword. It can work really well, or it can do other things that you did not expect. So when you get Botox for pain relief, you have to ask your dermatologist / dentist how the Botox will affect your appearance and your face shape. And if you don't want that to happen, then you need another way to manage your TMJD. Botox is not going to work for you. Okay, please send in more questions. I'm happy to answer them. And yeah, toodaloo. Look at this line. Absolutely stunning.